If you are over the age of 70 and your doctor proudly tells you that your blood pressure is now perfectly controlled at 120/80, you might want to hear this before celebrating. Because according to recent medical research, that perfect number might not always be the safest target for older adults. For decades, we've all heard the same message: lower blood pressure is better. Doctors, health campaigns, and medical guidelines have repeated this idea again and again. And for younger adults, especially those in their 40s and 50s, that advice is mostly correct. Controlling blood pressure early in life reduces the risk of heart attacks, strokes, and kidney disease later on. But something very important begins to change as the body ages, particularly after the age of 75. A major study followed more than 15,000 adults over the age of 75 for 5 years. These were not carefully selected healthy volunteers. They were real people from everyday life, including seniors with diabetes, heart disease, and other common health conditions. Researchers carefully tracked their blood pressure levels and monitored what happened to their health over time. They looked at hospitalizations, falls, kidney problems, heart events, and overall survival rates. And what they discovered surprised many experts. The group of seniors with extremely low blood pressure, those whose systolic numbers were pushed below 120, did not actually have the best outcomes. In fact, those seniors had a significantly higher risk of serious falls. Their risk of fall-related hospitalizations was about 28% higher compared to seniors whose blood pressure was slightly higher. Even more concerning, the group with very low blood pressure also showed a slightly higher overall mortality rate. Meanwhile, the seniors whose systolic blood pressure stayed in a moderate range, roughly between 130 and 145, actually had the best outcomes overall. They experienced fewer falls, fewer hospitalizations, and in many cases, better long-term survival. So why would slightly higher blood pressure sometimes be safer for older adults? To understand this, we need to look at how the body changes with age. First, our arteries gradually become stiffer over time. When we are young, arteries are flexible and elastic. They expand easily when the heart pumps blood through them. But as we grow older, those arteries slowly lose their flexibility. They become more rigid, similar to how an old garden hose becomes stiff after years of exposure to sunlight. Because of this stiffness, the heart often needs slightly higher pressure to push blood effectively through the body. If blood pressure becomes too low, the brain may not receive enough blood flow, especially when a person stands up. The second change involves special sensors inside our blood vessels called baroreceptors. These sensors constantly monitor blood pressure and help the body adjust quickly when we change positions. When a young person stands up suddenly, these sensors immediately detect a drop in pressure. The body responds within milliseconds by increasing heart rate and tightening blood vessels, which stabilizes blood pressure and keeps blood flowing to the brain. But with aging, these sensors become slower and less sensitive. This means that when an older adult stands up, their body may take longer to adjust. During that delay, blood pressure can drop suddenly. This condition is known as orthostatic hypotension, and for seniors, orthostatic hypotension can be dangerous. It can cause dizziness, blurred vision, weakness, or even fainting. In some cases, it leads to falls that result in fractures, hospital stays, and long recovery periods. The third factor involves medications. As we age, our kidneys and liver do not process medications as quickly as they once did. Drugs can stay in the body longer and sometimes have stronger effects than expected. A blood pressure medication dose that works perfectly for a 50-year-old might lower blood pressure too much in a person who is 80. This combination of factors, stiffer arteries, slower body responses, and medication sensitivity, means that older adults often require a more individualized approach to blood pressure management. In other words, the same target number should not be applied to everyone. Now, here's something interesting. Many seniors only have their blood pressure checked while sitting down in a doctor's office, but blood pressure can change dramatically when a person moves from lying down to standing up. A reading that looks perfect while sitting might drop dangerously low when the person stands. And this is why some experts recommend a simple test called an orthostatic blood pressure test. The good news is that this test can even be done at home. First, lie down and rest for about 5 minutes. Then, measure your blood pressure while you are still lying down and write down the numbers. Next, stand up and immediately measure your blood pressure again. If the top number, the systolic pressure, drops by more than 20 points, or if the bottom number drops by more than 10 points, it could indicate orthostatic hypotension. This doesn't necessarily mean something's wrong, but it is important information to share with your doctor. It may suggest that your medications need adjustment or that your target blood pressure should be reconsidered. So, what blood pressure range might be safer for older adults? While every person is different, research suggests that many healthy seniors do well with systolic blood pressure somewhere between 130 and 145. For adults over 85, doctors sometimes allow levels closer to 140 or even 150, especially if lowering it further increases the risk of dizziness or falls. The key idea here is balance. Blood pressure should not be so high that it increases the risk of strokes or heart disease, but it also should not be pushed so low that the brain and body receive insufficient blood flow. The safest number is often the one that keeps a person feeling stable, energetic, and free from symptoms like dizziness or weakness. Another important point is that a single blood pressure reading doesn't tell the whole story. Blood pressure naturally changes throughout the day. It can rise during stress, physical activity, or even while talking. It can also be lower during sleep or relaxation. That's why many doctors recommend home blood pressure monitoring. Checking your blood pressure regularly at home provides a much clearer picture of your average levels over time. If you are over 70, keeping a simple log of your readings can be extremely helpful when discussing your health with your doctor. It allows you and your healthcare provider to see patterns and make better decisions about treatment. And remember, managing blood pressure is not only about medication. Lifestyle habits still play a huge role. Regular physical activity, a balanced diet, maintaining a healthy weight, reducing excess salt intake, managing stress, and getting enough sleep all contribute to healthier blood pressure levels. Even gentle daily activities like walking can improve circulation and support heart health. The most important takeaway from all of this is that blood pressure goals should always be personalized. Two people who are the same age may have completely different health conditions, medications, and physical abilities. A number that is perfect for one person may not be ideal for someone else. So instead of focusing only on hitting a specific number, it's often more helpful to focus on how the body actually feels and functions. Are you experiencing dizziness when standing? Are you stable while walking? Do you have enough energy during the day? These symptoms can provide valuable clues about whether your blood pressure is truly in the right range for you. If you are over 70, it may be worth having a conversation with your doctor about your personal blood pressure target. Ask whether your current numbers are appropriate for your age and health condition. Discuss any symptoms you might be experiencing, and if possible, bring records from your home blood pressure measurements. Being informed allows you to participate actively in decisions about your health, and sometimes understanding the bigger picture can help prevent unnecessary risks. Because when it comes to blood pressure in older adults, the goal is not simply the lowest number possible. The goal is the safest balance that keeps the brain, heart, and body functioning properly for many years to come. If you found this information helpful, consider sharing it with a friend or family member who may benefit from understanding how blood pressure targets can change with age. And remember, staying informed about your health is one of the most powerful tools you have for maintaining independence and quality of life as you grow older.